Welcome to Tell Me More, Coffee with Chris Yip, the official podcast of the Faculty of Applied Science and Engineering at the University of Toronto. Each month, I sit down with someone from our vibrant global community to talk about what places them at the heart of designing bold solutions for a better world. You'll meet alumni, students, and professors who are making a difference across a range of fields, including some where you may not expect to find them. My guest today is Dr. Michelle Murti. After graduating from our engineering science program in biomedical engineering, she became a physician specializing in preventative medicine. She has worked for public health authorities across North America, and last September, she was appointed the Medical Officer of Health for the City of Toronto. Dr. Murti, welcome.
Thank you so much for having me.
It's super cool to see where our graduates have gone, because when I saw your appointment in the newspaper, I was just kind of flipping through it. I was like, that's kind of cool. And then I realized, wait, engineering, University of Toronto. I need to talk to her and find out about how the path you took to such an important role within the city. So, can you maybe go through that journey?
Sure. So I had a great time, EngSci biomed at UofT. I think I actually started when I first started EngSci. I was thinking about the environmental option, but it was quite developmental at that time. There wasn't a lot of courses options, so I ended up doing the BME route. And in the fourth year thesis project, I was actually working in the dentistry building with Dr. Paul Santerre.
Paul, yes.
Doing biomaterials, and I really thought I wanted to be a dentist. So during that fourth year project, I applied to 4 dental schools and 1 medical school. And then I got into both and then had a heart-to-heart with myself and said, okay, maybe I'll choose medicine instead of dentistry, which probably was the right decision because now I have a lot of neck and back issues. So the idea of being hunched over somebody all day was probably not the best choice. So I think I made the right choice.
Right. Did you do PEY or did you just
I did not. No, I didn't do a PEY.
Professional experience year for those who are.
So I went through, I did have a couple of, summer experiences working Dr. Eisenman's lab.
Moshe Eisenman, yes.
Yeah, and a couple other experiences. And then, was able to do some of the prerequisites for med school just in my last year. In the fourth year, I had to pick up a couple night course to be able to apply to medicine and dentistry, which was kind of a late career trajectory for me. But I think it was good to have that experience and really, seeing where people could go with it. As I said, at the time, biomedical, I think, was still a bit developmental.
Right.
And so most other graduates in my program were really looking at master's, PhD to really have a bit more of a viable future. And I was like, oh, that's a lot of grad school. I'm not sure if that's for me.
So I'll go to med school instead.
I'll go to med school instead.
So I'll take a different path, but still have a lot of extra courses and stuff like that.
Yeah. Obviously, the switch into medicine, the biggest change there was learning how to memorize.
Right.
Because it's such a, not the thing we do in engineering. We're all about like systems and how to take it apart and, start from the basics and first principles to really think about an outcome. And now having to go full on memorization, that was the biggest transition for me.
Were there other engineers in your program?
There were, surprisingly. In our class of about 200 for medical school, there was about 12 engineers.
Okay.
Yeah.
So you've moved around in a bunch of different spaces, probably specialties and so on, but now you've kind of landed in public health. And what was the path to get into public health?
Yeah. Through med school, lots of different interests. When I finished, I went into family medicine. So I did have options to practice both in Toronto. I was a family doctor in New Zealand. And then I came back and really wanted to then further and go back to do that public health training. So then it was a continuation of a residency program, included a master's of public health as well as residency training opportunities, mostly through Toronto and other places. And then after I finished the public health residency program, I decided I still wasn't ready. So, going back to the days of saying I needed more. I didn't want to do more back then, but now I want to do more. So I went down to Atlanta, the Centers for Disease Control in the States, to do their Epidemic Intelligence Service fellowship. And so that was really, I think, foundational experience for me. And then launched my career. After that, I did come back to Canada and worked at Fraser Health Authority in British Columbia as a public health physician there.
So moved around a lot of different exposure to different systems and different challenges in those areas. I don't know if you know, one of the things we launched with Dalalana, the School of Public Health, is really a public health certificate for engineering now.
Oh, great.
And this was really the idea of, the origins of civil engineering came out of that particular domain, right? And Actually, I forgot to mention this. We are sitting currently in the Fitzgerald building on campus just off of college in what was the original School of Hygiene for the University of Toronto. So this is kind of symbolic that we're actually doing this interview in this particular space, right?
There is so much overlap between engineering and public health. I mean, a large part of our workforce at Toronto Public Health are public health inspectors. And so this is a discipline that, they're what the former, Institute of Hygiene would have been. So, back in the day, they would have gone to a school of hygiene to become a public health inspector. And so they're the ones making sure the water's clean. They're the ones making sure sanitation is working properly. They're the ones checking on all the restaurants and making sure, giving that green card in front of the restaurants or checking every single pool, every single tattoo parlor, every single place you get piercings. They inspect those places to make sure that they're clean and safe. And, I think that's a piece that people maybe take for granted, don't even realize that that's a function of public health, and the work that we do every day is to make sure all these services that people use are clean and healthy.
Right. And so, and that also links back to sort of the larger civic infrastructure systems as well that engineers are sort of inherently tied into as well, right?
Yeah, absolutely. We work very closely with our partners at Toronto Water, as well as the wastewater systems, to make sure, clean drinking water. And we have a really close relationship with both the physical infrastructure of delivering water across 3 million people in the city. And, from an infrastructure perspective, nobody wants to not have water coming out of their hose. But also from a quality perspective, we're making sure that there's not any risk to health from the drinking water that we have.
To me, it's an interesting intersection because when you sort of think of engineering and health, you do tend to think of sort of the doctor side of it, when people go into that space, or biomedical engineering and that. But then public health is actually a very translatable area, right, for engineering.
There is so much overlap between the two disciplines. I had the pleasure actually during the pandemic when I was working at Public Health Ontario. I got actually invited by the engineering school to be a judge for the competition they were having for students of multidisciplinary. So they got a couple of options. So some of it was things like reusable PPE. How do we address this shortage of PPE by now having reusable PPE? And it was fascinating to see what the students were coming up with, because they're coming up with from a design perspective, from an equity perspective, thinking about different sizes of shapes and faces and facial hair, and how all the other features that we need to be incorporating into design. So really thinking much more broadly than just sort of, I think, what people might think of as traditional design or traditional medicine, but really bridging those two concepts about usability, feasibility.
Certainly during the pandemic, there was a lot of crosstalk between public health and engineering, especially around mass detection, aerosol monitoring, modeling of all sorts of stuff that was happening, right? Disease progression, tracking cell phones, all that kind of stuff, and trying to see what was going on, and using engineering approaches to that.
Even
really
things like systems engineering, really thinking about we had these for the first time mass immunization clinics. We had mass immunizations in the clinics in the past, so things like in 2009 when we had the H1N1 pandemic, but not to the size and scale that we did obviously through COVID-19. And we did get to work with engineering students who really looked at that process mapping of it. How do we make this more efficient, that we can actually see the hundreds and thousands of people that we needed to vaccinate over a short period of time. So that was a really great relationship that we fostered, and I think looking forward to how we can continue that going forward.
Yeah, I think there's some awesome opportunities there. So public health, you put the signs up on the windows and we sort of look for a green thing and then we go in there. We don't often know what goes on behind the scenes, right? Can you describe a recent public health initiative and how it works?
Well, I think there's lots we could talk about
yeah,
on
sure.
there.
Good
Just
example.
my day is sort of filled with lots of different things. I mean, I'm just looking outside the window and I'm seeing all the snow piled up outside. So maybe we could talk about snow and the weather we've had. Like what's the public health impact of that? So things like surveillance. So that's a big part of our role. Obviously, is data and looking at data and understanding data. What does that mean and tell us? So we're looking at things like emergency department visits for cold-related issues and tracking those over time. We've had a polar vortex. What happened? Did we see any big increases in emergency department business for that? We also think about the health protection messaging. So we talk about, what else we be doing. We've had to open a number of shelters to be able to make sure that there are places people can go during these extreme cold weather events. So then again, we're looking at infection control in these settings. We're looking at the food safety and prep in those settings to make sure that that's working well. We're looking at, the overall hygiene of those places. And then on the health promotion side, what kinds of messaging can we have to really keep people safe and healthy during cold weather events like this? So thinking like, if you're, what are some of the health risks of shoveling snow? And we know that sometimes, that if you're can increase risk of things like heart attack in the snow. But also on the positive side, we want people to be out and getting active and not shut up all winter, because that's not good for your health either. So really thinking about the kinds of public health communications that we can do across the city to say, here's the ways we need people to stay healthy, don't get frostbite, don't stay out too long, don't get, be sick in the snow, but also get out there and still be active, check on your neighbors. We know social isolation is a really big contributor to ill health, especially for older people. So make sure you're checking in on neighbors, be the kind neighbor, shovel their walk if they haven't done it, so that other older people are not going to slip and fall on the sidewalk. So lots of different ways that maybe people don't think about how public health can be involved, but we have sort of touched on a lot of different aspects of just something like a spell of cold weather and heavy snowfall.
Sort of the "be nice, clear your ice" type of slogan from yesteryear. Yeah, for
sure. But also just what's that actually, that health related component to it. We've seen in the States and as well in Canada that social isolation can be as detrimental to health as smoking or as poor physical activity. So we know social connectedness is a key part of staying healthy, especially as people get older and get more isolated sometimes. So, bringing it back to what is that health outcome we're trying to achieve, and we're trying to make sure that people are keeping well and staying well.
Cool. How does your work affect policy in a sense? So we also, I was saying, we have a public health certificate. We also have a public policy certificate that we've introduced through engineering. And my usual pitch for the students is sort of introducing new technologies, thinking about the regulatory side of it. But with cold weather alerts, who defines, for instance, the temperature threshold at which you would open more or less, or the same with in the summer, we go the opposite direction. When do you open a cooling center? Do you help define those thresholds?
We do. So certainly public health is a city division. So in the city of Toronto, we're our own agency, but we're also a key partner to other city divisions. So we would work closely with places like Toronto Shelters and Support Services to look at, when are they activating their cold weather plan or their hot weather plan. We moved away from kind of defining very specific levels, but from a policy perspective, recently we worked together with municipal licensing and standards to look at putting forward potential for a bylaw to say a maximum temperature for rental units. So right now we have a minimum temperature. So if you rent a place, your landlord can't let it get below a certain temperature, because then that becomes, unsafe and too cold. But we've never really had a maximum temperature. So when you think about some of the extreme heat days that we've had and people who don't have access to air conditioning, that can become a pretty, not just uncomfortable, but unsafe place if you don't have anywhere else to go and it's getting 30, 32 degrees in your apartment building. It's not something we can implement overnight. You can't put air conditioning in every unit over a short period of time, but how do we work towards that? How do we look at what those options are so that people have access to cooling? And we know that actually heat is probably much more likely to cause death than cold. Way more people are risk at dying. So how do we kind of have some options there to work with city partners on?
So you've taken on this cool new role, right? Mm-hmm. As of September. So you're just, 6 months in?
Yeah,
something like that?
Yeah.
What are some of your priorities?
There's a lot going on. There's a lot. I mean, we're still definitely shifting from out of the pandemic mode. And I think what we're really seeing from that is a lot of the things that maybe didn't have as much attention or were exacerbated during the pandemic are things we really need to focus on now. So things like mental health. Mm-hmm. We know we had serious disruptions to kinds of services, as well as the anxiety that was being introduced through the pandemic. So mental health is a really big area. Also, where we're now in terms of geo-economical situation, affordability, I think, is really top of mind. And people, might think like, well, you're in public health. What is affordability? We're not changing this price of food. We're not giving people homes. And that's true. But I think what we see is the health outcomes when affordability is bad. Right. We see when people can't afford food, what that does to their health, what that does to their mental health and physical health, what that does to their family dynamics and relationship. So really, I think looking at, one, highlighting that relationship, because I don't always think that people think about affordability in health in that same way. So one of our kind of my key areas is really trying to measure that and demonstrate that, and what, how we can bring more people along in this concept. But also then looking at our services, how are we helping to really make sure that our services are reaching people that we need to. We have things like 3 mobile dental vans, as well as dental clinics across the city for low-income individuals. And I think it was one of the things that people kind of forgot about during the pandemic. And so we're really trying to re-bring that back, make sure that people are aware of those resources. How do we get back out to communities, into places that, maybe wouldn't even think about trying to access a dentist, and making those relationships to bring that back and say, how can we make your health better, as well as maybe also connect you to some other services. We have a lot of addiction services. We have prenatal programs for new moms and babies, especially for newcomers or people with other supports. So really, I think kind of leaning into those areas about how we can reconnect with communities and see what's needed.
The mobile dental clinic, I hadn't even thought about that. It's super important, right? Because oral health, if you don't have bad oral health, then you have problems eating, and then you have pain, and then it all propagates, and it all goes downward from there.
Yeah, right? Increased risk of infection, increased risk of, actually, we've shown heart disease of people who don't take care of their disease, increased risk of diabetes because they're not eating as well. So lots of, I think maybe that's going back to my fourth year project. That's my passion for public health dentistry here. But, I think that it's also a really important way that we can just connect with people who might kind of otherwise feel forgotten or not necessarily feel comfortable accessing services. But when we can go out there, we've seen a lot of clients who haven't seen a dental care person for over 20 years and, are afraid of it, and then being able to have that trusted relationship to say, like, okay, well, what about some of these other services? Can we also give you your flu shot? Can we also give you your COVID shot? Being able to have more of that relationship in our communities is really important.
This is all local, but public health is obviously global, and you start thinking of pandemic things coming in. So what's your perception on how you engage on the global side as well?
Well, it's so important. And I think we, learned that even more than ever during the pandemic, that we have to be paying attention to what's happening around the world, because it's only really an airplane ride away before that's in Toronto. And we've known that for a long time. But, what I think we really helped develop is some of those relationships with key partners across the country, as well as across nationally, internationally, to maintain those connections and really learn from one another, because lots of good ideas are happening all across the world. We have, really been fortunate to be part of something called Partnership for Healthier Cities, which is a Bloomberg-funded initiative internationally where cities across the world can participate and work on similar common projects. So, we've been part of it to look at some heat-related projects, but also lots of cities around the world are looking at things like student nutrition programs, the opioid crisis, lots of other things that we can be working on together and learning from, other cities around the world who might be doing things a lot better than we are. So it's a key part of the work that I do every day in terms of keeping that eye open to what else is happening, to be able to bring that back to Toronto. The global surveillance and I think that's one of the most challenging parts of the last year or 2 years that we've had, with a certain new administration to the south, that a lot of the funding for global surveillance has now been disrupted. And so we're having to rebuild some of the partnerships, find new funding sources to have that kind of network and connection, because a lot of it was coming from the U.S. And now I think we need to really think about, okay, how do we have that type of infrastructure? So if there is something brewing in southern Thailand, we would know about it. If there's something happening in, South Africa, how do we know about that? It's not enough just that we're investing in surveillance in Toronto. I mean, we obviously need to have really good surveillance here because people from around the world come here all the time. And we, if something's going to arrive, it's probably going to be in Toronto. So we're always ready for that prospect. But we would be even more ready for that if we had that same kind of surveillance all across the world, and that, as soon as something was happening somewhere else, we would know about it as well. And then we could be monitoring for that. So we're in a challenge time. I think we'll come through it, but definitely it's something we're looking, and it's not just public health issues. Engineers could be part of this too, and lots of other disciplines need to be part of that.
One of the comments that happened during the pandemic was all about public trust in public health. Do you face challenges in that right now? And people sort of, well, they said this, I don't really believe it, I should follow this. And maybe around the vaccination clinics and stuff like that. How do we broadly address those kind of concerns?
Yeah, I mean, this is a daily issue for us. So it's not just a sometimes issue. This is a daily issue that we have people presenting with misinformation. I mean, I think vaccine is probably the thing that people think about the most, but we have it for a range of topics, right? People read something and they think that that's there. And what I think is the challenge is people don't think about the harm that's actually causing. So it's not just that you read something and it's totally nonsense, but if you took or didn't take a medicine or took something else for something that you could have had treated, that's going to have consequence for you. That's going to have consequence for other people around you, because now you might be infectious in a way that's spreading to other people. So it's something that's very top of mind for us. We're really trying to increase that trust factor for Toronto Public Health, to say, we're going to try to really improve the information on our website so people know this is a trusted source of information. But we also know that trust is really local. So there's something called the Edelman Barometer of Trust that they do every year. It's a survey to look at, who do people trust, what sort of their circles of influence. And this year, the new data that came out January 2026 to say that the people's sphere of influence of trust is getting smaller and smaller. So in these kind of crazy turbulent times of everything that's happening out there, people are now really only listening to a very small circle of people around them. So that means that all of us have a responsibility of being communicators of correct information, right? Like, don't just forward something you read, and because that's going to amplify misinformation, right? We need to be able to address something. If you're talking to your neighbor, they're saying something, be brave. Tell them, really, where did you get that information? Can I provide you some other information about that, because that doesn't sound correct, or how to have that conversation, because it's not an easy conversation, right? If your grandma's talking to you and be like, no way am I getting my flu shot, that's a tough call sometimes to say. How do you have that conversation with somebody that's close to you and might be have a different idea about things? But I think the more that we can do that, each of us, all of us in our individual lives, and I think that's part of the role of public health, is how to give people some of those tools to say, how do you have those conversations when people are saying things that are incorrect? I think that'll help, because it's a force amplifier if we can each do that for our own circles of influence and try to get people to be critical. It's hard with engineers because they're already critically thinkers, right? Like they're kind of more immune to misinformation, because they're always like, well, really, why? Tell me the data,
But we ask too many questions.
Yeah, but that's great. And so we have a whole then group of people, all the engineering students who already think that way, and then can have, help amplify that in their personal lives as well, to say, let's think a little bit more critically about some of the information that's coming through.
Thinking back to your undergrad days, and you did talk about pivoting from dentistry to medicine. We get this all the time. Students coming into engineering and thinking about, should I go into engineering to go to medicine or to public health? Or should I go the other way, which is life sciences? And what advice do you have for students? I mean, given where your career path, and even thinking about how much engineering is playing a role in how you're doing things today.
I think it was a great trajectory to do engineering and then medicine afterwards. If anyone's thinking about it, I would highly recommend that as a path. And I think when they're, partly why I chose engineering science was, hey man, I didn't necessarily know. I mean, I sort of had this idea about environmental engineering, but was still pretty naive about what else was out there. So I think staying open through your career as a student is always my key recommendation to any young person kind of thinking about what they want to do, because, it's not the careers and jobs that we have now are not, so linear or defined in that way. And I think learning what you can from whatever program we're in, staying open to opportunities that arise, and lots of different ways to get to different outcomes. So, it is a great option. Definitely is not limiting to be doing engineering first and then in medicine. As I said, lots of engineers in my medical school program. Some of them went on to orthopedic surgery, some of them into neurosurgery,
right.
Some in internal medicine,
Family medicine.
Medicine. So lots of different ways that they're applying their undergrad in engineering into their medical career now.
This has been a fascinating conversation. Thank you so much. I think there's so many elements of public health, obviously the career trajectory that you've done, but also the way engineering plays such a pivotal role in delivering in that space, right? Providing innovations, whether it's surveillance tools, whether it's monitoring systems or data analytics. I would love to follow up with you on how we can introduce our students to your department and get a sense of, here are some of the challenges we face daily, or here are some of the long-term ideas that we would, could we do this? How could we do this? Love to introduce that idea to our students, because this would, to me, would be a terrific entry into this particular field.
Yeah, I think, coming together with these real world problems and, maybe coming out of the pandemic, people have such a different idea about what public health is, but maybe not in the full sense of all the things that we deal with. But it would be great to introduce them to some really, very common challenges that we're dealing with and getting some new ideas, getting them to spark an interest in how they can be applying what they're learning on a daily basis to a different kind of problem. I mean, we didn't even talk about AI, but that's really I think that ultimate kind of actually intersection between public health and engineering, because it's all about social engineering. It's all about how and that's a lot of what public health is. We're health promoters. I call ourselves the no fun police, right? Because we're always telling people, don't do this, don't do this. But it's also about nudging people to healthier options and reconstructing society so that those healthier options are the easier option, because that's how we really know that behavior changes, right? When you get in your car and you don't even think about putting on your seatbelt, that's public health at its best, because we're saying, we've changed the whole infrastructure. This is now just the default, and you wouldn't even think about not doing that. But what else can we do that? We think about social media, and we talk about youth mental health and that impact that social media is having on youth mental health. There's a great intersection for engineering and public health to come together to say, how can we put in controls? We've seen what Australia is doing in terms of an age limit, using, new innovation. They have to do better facial recognition to say, are kids 16 and under or not? But what about even just designing so that social media in that first place, putting in different guardrails so that it's not as addictive, that there's more timeouts, that there's, different ways that people are engaging with that technology so that it's improving mental health and not making it worse.
I hadn't even thought of it as a public, but it is actually a public health emergency right now. People
right now, in the UK, they're actually declaring it as a public health emergency in terms of the impact that social media is having on youth mental health, because we know this is a key driver in terms of people not sleeping as much as they should, people not getting as enough exercise as they should, having experiencing significant bullying online, feelings about themselves, withdrawal and anxiety, depression. They're really connected, and I think that we're trying to find what's the answer to that, because we know that you can't turn it off, right? Like, we're not going to not have social media, but if we have it, what else can we be doing to make it better so that we're not experiencing these outcomes?
That's cool. I honestly had not thought about that as being part of inside your mandate.
Well, I mean, really anything that is impacting health is part of our mandate, right? Our job is to protect the health of the population. And if these are the things that are driving people's health, then it is in our mandate.
Yeah. Wow. Amazing. Thank you so much.
It's a big job.
I was going to say, it's a huge job. And it's just for the city alone, then it's multiplied across the provinces, multiplied across the country, internationally. And as you said, like, all these things are impacting us all globally, right? So it's a fascinating topic. Thank you so much for taking time today to be on the podcast. It's been a wonderful conversation, super interesting, and really look forward to working with you, bringing your office into campus and doing more stuff with our students.
We would be happy to. We're just down the road.
Awesome. Terrific.
Thank you so much.
Thanks.
Nice to see you.
Good to see you. Thanks again for listening to Tell Me More, Coffee with Chris Ship. If you want to catch up on past episodes and to make sure you don't miss the next one, please subscribe. We're on Apple Podcasts, Spotify, and more. Just look for Coffee with Chris Ship. You can also check out at UofT Engineering on Facebook, Instagram, X, and LinkedIn for more stories about how our community is building a better world. And finally, if you'd be inspired to join us, we'd love to welcome you. If you're thinking of taking a degree or working with us on our research projects, you can find us online at engineering.utoronto.ca. Or you can visit our beautiful campus in Toronto, Ontario, Canada. I hope I can join you for coffee soon.